My friends and I go to West Virginia every year. We're riding off-road. My ATV landed on top of me, which broke both my pelvis on either side, 2 broken ribs, fractured elbow. Had to go to the hospital there. They took care of the pelvis there, but they wanted to keep me there, and I wanted to come home. This is where I wanted to go.
I received a phone call from my mom saying that Joe had been hurt in an ATV accident. Joe is my stepdad, and so I talked to my mom about the continuing care program at Parkview LaGrange. It would get him closer to home. So the continuing care program is for patients who are needing some short-term rehab before they go home and transition home safely. Here in the hospital setting, we're able to offer the same nursing ratios that we do for our acute care patients, as well as some of those other services. So if you were to maybe need an x-ray, we can do that. We can do some labs for maybe some of those patients that might be a little more medically complex as well. Whether that's one of our Parkview facilities or if it's an outside facility, the referral would go to our case manager. So we look to see what has physical therapy said, what has occupational therapy said the need is, and do they meet the criteria where they're really needing some rehab. It is the whole team that looks at that patient and what are the needs and what the entire interdisciplinary team can do to help transition that patient safely home.
Going home at that point was really not possible. I needed help, and I needed to heal. They went out of their way to take care of me.
Our patients are seen by our physician, our pharmacist, your nurse, especially physical therapy, occupational therapy, and if needed, respiratory therapy and speech therapy. It's very patient-centered, it's very patient-focused.
My day-to-day program was getting up early. Becky, my physical therapist, really worked me hard and was able to get me back in shape in a short amount of time. It was amazing the things that Becky was able to help me do, simple things like putting on my socks. Normal day-to-day, you don't think about those things, but I couldn't do that.
Part of the continuing care program includes a process called our Care Conference. The Care Conference is done weekly, and that includes the interdisciplinary team as well as the patient and family, making sure we're getting their input, asking a lot of questions about the home environment so that they can give recommendations on how the home can be safely set up for the patient when they do transition back home.
When I went home, I'd say I was 90%, and so the rest is just healing. I hope it's not necessary for continuing care for anybody, but if they need it, they took care of me so well. I missed them when I went home.
If I recommend it for my family member, which I wholeheartedly did, and he's doing amazing, I would absolutely recommend that for anybody else and their loved one.